You need fan?
I don't know. Do you need fan? Okay.
So sometimes for some patient or with high, when you increase the frequency, sometimes we use 40, 50, but maybe some for active keratosis, but most of the time you don't need, okay? But you just give the fan to the patient and they set on easy, but really no need.
I don't know if you can see how it is working. I can do it this way so it's better to see. So, and how I normally we use this, of course, the indication. I have another indication. I've been doing a lot of stem cell, you can say microfat, millifat, and nanofat treatment. We set up a protocol with pre-treat the skin with a low dose from 12 hours, 24 hours, or a few hours before to create a little subclinical inflammation, because we know stem cell working and activation factor working better in the healing process.
And after that, you apply some
Yes.
drug delivery or cosmetic delivery?
Not that no, I do. Yes, this is another story. Before surgery, I do it. I wait 12 hours and I do the transplant, the injection of fat. So the stem cell, you know, it's not only stem cells. Stromal vascular fraction will find an environment a little bit affected with a little inflammation, so working better. In using other cosmeceuticals like exosome, vegetal, human, or other cosmeceutical product, you use the power of.
Oh yeah, show the redness.
Yeah.
Really, you know where you are after the session. You see really the different passes you did, okay? But so wrinkle, okay? Because you have two wavelengths. It's interesting. For me, it's a performance to have 1550, okay? It's a normal. So to be efficient is between 50. Most of laser fraction non-fractional are between 50, 40 to 56, 70, but really 50 was discovered by Tankovic, Nikolai, and it's a very well-known wavelength, and it's interesting to have the tubium in the same. Most of the time you have to take two handpieces, but for this device you have the both. If you want, you can mix or not, and you can really modulate the frequency.
Because if I want, I can take out, or if it's painful, I can change. Another very important thing is to manipulate substances like thulium. It's well known now.
Why to associate in the mix? Do you have any interest to mix both? Because some.
Yes.
Yes.
We found a new indication. We found having can change the hand and do the same thing. We do a clinical study with histological study, where we found the first erbium is deep, 300 micron, thulium 200, but together they reach more than 1 millimeters. And this justifies the better result we have in the very beginning. We was not justified only for a single wavelength.
50-50, sometimes you can reach depths 1.2 millimeters, sometimes with high frequency, you know, because 20 is not enough, you know, and you can evaluate the thickness of the skin, the scar. You know that for scar after surgery, it's unnecessary to go too deep, okay? But you cannot really, some scars are very difficult to treat, like keloid, so be aware when you have a keloid on 5 millimeters thickness, it's more difficult to treat just with a laser, so you need to combine. But really it's very helpful and for any phototype, so really it's interesting for daily practice. Yes, we are on the battery. A battery, you cannot treat 20 patients a day, full face with this device. You need maybe to buy a second battery. But really for a plastic surgeon, 4 hours.
4 hours.
Yeah, but you know in Italy we work 12 hours a day, okay? So we need more battery than you now. Now it's a joke. But really it's interesting, you know, in my practice, as young practitioner, or sometimes my young collaborator takes the devices and put in the pockets and they leave and they come back at the end of the day and say it was super. Because you know you can stay in your room where you do consultation. It's not unnecessary to go to the specific dedicated room, because even you take care of the eyes, but you ask your patient to close your eyes, because but you are protected by the tips. Okay, it's very interesting. Even you have to take care because it's laser, right? It's a diode laser with a double wavelength. So small wrinkle, it's interesting. Yes, we have any
I
question?
have a question, yes.
Yes, for sure.
How many shots does the one tip have?
How
many
million.
shots?
1 million.
1 million.
So one tip is one patient for one patient?
No. We calculate 40 patients, yeah. Anyway, you calculate if you do a face from 20 to 30, if you do a face and neck, depending on how many passes, it's from you'll reach 60 or 80 if you do the maximum.
Yes, but you can clean like a tips for a laser, okay? And you can remove the roller. And it's very important. Inside you have a small glasses, it look like a diapery glasses. You need to clean. It's very easy, but you have to take care. You have to check if it has any laser. We don't change the handpiece of our laser CO2. We don't change the handpiece of Pico, many other laser. But you have to take care. But the tips, if you want to change the tips, you can. Okay, you can. If a patient want to come again, she can have, if she want, on tips. Or maybe if you want to share this device with your colleague, because you find that it's unnecessary to have just for you. What you do, you buy the device,
Right.
and you have your own handpiece. If you use your handpiece more than your colleague, he pay for his own handpiece, you pay for your own handpiece. So you can share. It's very easy. It's very comfortable for
You
some.
know exactly how many times you use a laser, because
Yes.
the count.
54 percentage of the use, you know. So you have always some information about your device. You have a counter. So it's interesting when you want to make a full face. It is maybe 50,000 shot. Really, it's interesting. You can calculate, and to be reproducible for the next session, you can say how you estimate with how many shots you need.
Of course.
Any questions from the floor?
Yes?
Questions from the floor?
Seems that everything is clear.
Yes, it's interesting, Giovanni, you are plastic surgeon, Teresa, you are there. You have the perfect combination, the same as me.
Yeah, but you too. So
But
you are the combination already.
Yes, I'm very full. I encourage, you know, for them, it's very common. But to have this portable device to change your clinic, maybe Teresa, she has a 100 clinic in, okay? So yes, but for plastic surgeon, it's very interesting.
Yeah, really. And you can treat the scars.
Yes,
The
scar.
scars, as soon
Fresh
as you
scar.
have
Fresh scar.
normally you're not able to do it. with
Oh,
Can you use
you
it
have
on the
not-
upper eyelid?
Yes, you can do it also eyelids. Of course, it's a non-ablative. You know the
No, ablative.
golden
The
standard.
depth is around 1.2 millimeters maximum.
Show you.
So be aware. If you want to create eyelid, if you are in contact to the bone, it's okay.
Can you apply anything after the
But
exosomes
stay on
or
the bone, no more.
what do you
There's
apply?
a question
Or
from
put
the
low.
floor. There's a question here.
Yes.
Do you apply any thing after like exosomes or
Yes.
any kind of products?
Yes, skin booster, whatever you want, you know, because you can estimate to reduce inflammation or redness. It depends where you are, in which country. Yes, you can do. Some colleagues do some session with a photo biomodulation just after with a red light, if you want. But as a first target is laser. It's laser first, you know. For my part, I don't use exosome. Sorry for that, to say that. But I prefer to use skin booster. And sometimes I put patient under LEDs, redness, for 15 minutes to reduce redness and pain. But even, is it painful?
It's painful. Merci.
It's okay. Okay.
If you have,
Can you treat hand, neck,
yeah.
full body maybe?
Yeah.
Full body.
Yeah.
Okay.
Of course, with different
Not sure.
colors. Of course.
Okay.
If
I repeat, the line is maximum is 14 millimeters. So for scar, you need to adapt the distance.
Yes.
So if you have a small scar,
Alright.
8 to
Look, here, distance, big scar, small scar, until 2 millimeters.
spacing. Can you the
Yes,
spacing is
spacing.
maximum
2 millimeters.
and minimum is 0.5.
0.5.
So be aware.
0.5.
You can use it, okay, but the risk, really to be comfortable, sometimes you can induce some just blister with
Yes.
any laser. But really to induce scar is impossible. Really
No.
it's impossible. No need.
And this is really, let me say, the revolution as we have from the big computer to the iPhone. And I think in the future we have more and more portable device, pocketable device. And another thing is what's happened when a laser in the morning you have the full agenda full of patient, your assistant switch on the laser doesn't go. It's a nightmare. And the nightmare starts when the assistant says, okay, we'll send the technician in 2 days. And after, always a problem. This is very solid. I think the only problem is go down, but this is only for your glass. Yeah?
Yes.
Yeah? And must be careful. But you can have also a little strip over here. And the assistance here is in France, because they produce in France. It's an American pattern, Russian America, because the inventor Nick is Russian, now it's 100% American, and he patented in the US, and he patented all around the world, also in China. But the producing is here in Clermont-Ferrand. So from here or any part of the world, there is many distributor. You can send DHL the laser, and you will be back another one. It's not possible to open and to repair, except from professionals. But in the meantime, you will have, and this is not possible with a big machine. They cannot send you in
And the most
your pocket.
important thing about the power,
The power.
until 50 millijoule,
It's a lot.
you can compare with a lot of big devices we have in the market, exactly the same. And Nikolai Tankovic estimates that it's unnecessary, but I know that if you want, you can
Oscar.
ask for
Oscar.
70 millijoule. But really, what for? I use since now 2 years, and we believe that it's unnecessary. About scar, you need sometimes more between 3 to 5, but it depends. It's a new scar, fresh scar, or old one. Okay, for acne scar, for acne, active acne, we don't wait. It's very comfortable for you patient. You can use really. Be aware if your patient are isotretinoin, but it's not forbidden today.
Yeah.
We know that you can use it depends which quantity of drug you take, but you can. It's unnecessary to wait the end of the treatment of acne. Active acne works. You don't have any flare-up, and it's very interesting for them. Young derms, they don't want to invest in a big device. Sometimes it's too expensive to have a platform, big platform. For that, even for them, you have many indications.
You have 1 minute to wrap up.
Yes.
You're
Okay,
done?
The downtime normally is few hours. It's depending because it's not ablative. Okay. Here, yes, you can see the redness. The redness is away, but now we have the middle of the power. If the power is stronger, higher, of course you have few hours. But exactly like all the other non-ablative. And the binary means two wavelengths in the same hole together, because before and after in the same hole is quite impossible. You understand why.
To conclude, you are happy?
Yes, and I think every user happy. And you happy?
Yes.
Use it, you happy.
Yes, it's comfortable. It's an ultra portable device.
Yes.
Okay.
So if
Okay.
dermatologists and plastic
Thank
surgeons
you
are
very
happy.
much.
thank you guys. Thank you
Okay,
guys.
thank
It was
you.
very nice having you. Thank you. Thank you.
So our next speaker is